New on the health beat today, a shortage of some chemotherapy drugs. According to the FDA, more than a dozen oncology drugs used to treat cancer are currently in short supply, including chemo. Chemotherapy drugs were in the top 5 drug categories affected by shortages through the end of March 2023. Last month, the FDA put out guidelines asking manufacturers to give more notice. However, some experts say there needs to be more oversight.
Most of our generic products are sourced overseas, and there's a lack of oversight and coordination.
There is supply out there and we are able to receive it. It's honestly on a week-by-week basis.
The American Cancer Society says expanded demand, supply shortages, limited manufacturing capacity, and low profit margins for generic therapies are reasons for the shortage. 3 News reached out to Metro Health, the Cleveland Clinic, and university hospitals to see how this shortage is impacting them here in Northeast Ohio. University hospitals responded with, quote, "The number of active drug shortages in the United States is at its highest in the past 5 years. These are national shortages and do impact university hospitals." It went on to say our providers and pharmacy team discussed supply, expected usage, and the outlook of shortage to make mitigation decisions to extend our supply on hand and avoid detrimental patient impact. We're still waiting on responses tonight from the Cleveland Clinic and Metro Health. That's a scary situation.
Yeah, I understand that when the generics enter the market, it drives their profit margin down. I'm wondering about the public health side of that.
Right.
I know that it's all for profit, but at the same time, if there are people that are suffering and need these drugs, you would think that someone would step up and fill that void.
Right. Well, very often, chemotherapy is a cocktail.
Right.
And so, they go with what works the best, what has the least detrimental impacts in the therapies. A lot of times they have other tools that they can use and bring into the arsenal to try and fight cancer.
Right.
But sometimes it is a, one-shot deal, and that's the one they want. So they're making decisions with the patients in mind, I'm sure,
All right.
on that.